everyone, my name is MRCOG. I'm a member of the Royal College of Obstetricians and Gynaecologists, and I'm currently working in the NHS. I've been guiding the Part 3 MRCOG candidates for the last few years, and through the forum of Grasp MRCOG, I make free videos and podcasts to make things simple for the candidates, and they can also be beneficial for all of us from the point of view of our day-to-day practice. If you want me to talk about any topic that you think is important from exam point of view or otherwise, just send me a message. I'll make a video or a podcast on these topics. Please do not forget to subscribe to my channel and press the bell icon so that you will be notified for my upcoming videos automatically. Thank you so much for tuning in. Hello everyone, I'll be talking about the oncology module today, and we will see how we can make the oncology module very simple, because it can be very tricky at times, and the candidates can be a bit nervous about this module because it can also involve the breaking bad news, and let's see how we can simplify it. So let's think about the precancerous and the cancerous lesions of the female genital tract. So you will have to go through all the precancerous and the cancerous lesions, but the most important ones are the cancer of the uterus and the ovary, VIN, CIN, and the precancerous lesions of the ovary and the uterus, such as endometrial hyperplasia, and not precancerous as such, but borderline malignant tumors of the ovary. So let's see, if a woman presents to you with a diagnosis of cancer, a confirmed diagnosis, then what you will do and how you will take the scenario. So let's see, if the scenario says that this lady is here after her laparoscopy, which was done a few days back, and she wants to discuss her report. So please discuss this report with her and also address her concerns. So I would suggest you do not attempt taking the history before going ahead with a discussion of her results, because she would be very curious to know her results, and if you keep on asking about the general history, she might get angry or frustrated or very anxious. And this happens in real life as well, because if the patient is there for a purpose and you are asking about a few things which are important for management, but you are not telling her what's going on, that can make the patient frustrated. So do not make your life difficult by starting with history. So my recommendation would be to break the bad news first. There is a protocol for breaking bad news which is called the SPIKES protocol. SPIKES is basically a mnemonic of setting, perception, invitation, knowledge, emotion, and summarize. And if we talk about the setting, let's see, if a patient is there and she's there alone and you want to break the bad news, how you can start breaking the bad news. So just ask her whether she would like to have someone else with her, a partner or friend, and in exam scenario, most likely she will say no, and then you can offer her a nurse or a support worker to be present with her, because you can tell her that I will be giving you a lot of information, that is why is it okay if I call them to support you. And then in terms of breaking the bad news, just tell them that I'm afraid I don't have a good news for you, and then you tell them that you have got cancer of the lining of the womb or cancer of the ovary, or you can just explain it a little bit more, because you had your surgery and we sent a report, some samples from your surgery to the laboratory, and then the report has come back as cancer, and I'm really sorry that to be the bearer of this news. So this is how you can break the bad news. And then you give her some pause to absorb the news, and then with her permission go ahead and ask her, would you like me to continue the consultation? And in exam setting she will say yes. And do not forget to show empathy with your body language, even if it's an online exam. Lean forward a little bit, and also in face-to-face exam offer her a glass of water or tissue paper. And you can also mention these things in an online exam as well, that would you like to have a glass of water, and should I ask someone to give you a tissue paper? So things like that. Basically, it will be a lay examiner station, and you want to tell the lay examiner that you are empathetic and you are considerate and you are understanding what situation the patient is going through. So the rest of the management will be different a little bit for different cancers, but generally it will involve the MDT. MDT is a buzzword, so always use this buzzword. Before coming to the management, after breaking the bad news, you will be asking her history with her consent. Is it okay if I ask you a few questions before we go ahead? Because it's important for me to know your background, since you are here for the first time. I'm meeting you for the first time. So then obviously she will say yes, and then you can ask about the history of present illness and then the rest of the history. If it's a young woman, fertility concerns and the usual gynecological history and history of cancer symptoms and the treatments she has already tried. So these are the basic things that you will be doing. And when it comes to the management, as I said, it will not be you or only your consultant who will be managing. Sometimes the patients may have to be referred to the cancer center after diagnosis. And if it's your hospital which is well equipped with these people, then you don't need to send them, but you just mention about the MDT, that your care will be taken or you will be looked after by a team of professionals. It doesn't always mean doctors, because some people say group of doctors. These are not only doctors, there are cancer specialists, nurses, sometimes social support is needed, so support workers, and that's why you just have to mention about each and every one of these. If you don't know, just generally tell them about the cancer nurse and the oncologist and the gynae specialist and the support workers, and also some counselors or psychotherapists, because these women will be going through a difficult situation. And always ask about the social support and her social circumstances, because these women may need people to look after themselves when they are going through the treatment of cancer. And also ask about the partner support or otherwise the family support around. So this is about the cancers generally. So coming to the pre-cancerous lesions, then you can tell them about the diagnosis first, or take a history first. It doesn't matter much, but if the patient asks about the result, then I would again suggest that you can tell them about the report first and then go ahead with the history. So how you will tell is, you can mention that like in case of cancer, you say that I'm afraid that I'm not a bearer of a good news for you, or I have a bad news for you. Here you can tell them that we did a biopsy, we sent tissue sample to the lab and checked it under microscope, and there are some concerns, so that they are prepared for that. You don't have to follow the usual steps of breaking bad news here, but you just alert them that there are some concerns, so that's why they are here to discuss the report. Because if the report is normal, then they don't need to come back to discuss the report. So you tell, for example, in case of endometrial hyperplasia, you can tell them that there were some, when we checked the biopsy report or the biopsy sample in the lab, then there were some abnormal cells in the lining of the womb. So then she will ask, what does it mean? Then you can tell that there is a chance of these cells to progress to cancer in so and so years, and things like that. Okay, so what are your management options? Then you can ask about the history if you haven't asked about the history previously, and then you tell them about the further management options. For example, use of progesterones and Mirena coil and follow-ups at regular intervals to make sure that the endometrial hyperplasia is settling down. And again, and you can explain the endometrial hyperplasia, for example, in terms of endometrial hyperplasia with atypia and without atypia, and tell them about the prognosis of both. And same goes for the CIN and the VIN, all the precancerous lesions. So you can make your own, develop your own style. But just to summarize, I would suggest that if there is a diagnosis of cancer, break the bad news, take the history, discuss the management options, and don't forget to mention about the MDT and also about the follow-up. Because in case of cancer, follow-up is also important. So women will have to come more frequently, like every 3 months for the first couple of years, and then every once or twice a year for the next few years, up till 5 years. So this is general and a brief summary of any cancers that you can apply to any scenario of cancer, and that might be helpful for you to pass the station if you do it that way. And similarly for the precancerous lesions, again, sometimes we may have to discuss these things at the MDT as well, but again, when you discuss the management options, there are different management options for different types of cancers. So you will have to go through the text and make your own small templates or algorithms for that. That might be helpful for you. So this is all about oncology module, but there are a few things to remember in this module, that practice a few times breaking the bad news. The reason is that many of the candidates, and generally as well the doctors, they are not good at breaking bad news, because it's not something easy. It can be very overwhelming for the patient, as well as it can be a source of anxiety or nervousness for the candidates during the exam as well. So other than your technical proficiency, communication skills are being checked in this exam. So if you're not prepared to deliver a bad news, then it may be very chaotic, and in that situation it will be difficult for you to handle the scenario. So that's why it's important to practice it a few times, and I'm sure with a little bit of practice you will be able to do it very nicely. And if you have any questions, anything else that you would like to discuss, please send me a message, and thank you so much for listening.